This video shows you a patient with chronic drug-resistant epilepsy who was referred to our center for a stereo-EEG procedure. The most probable diagnosis was epilepsy, more specifically from a lesion in the temporoparietal occipital transient zone, the TPO, and it's a case with bilateral periventricular nodular heterotopias. We use in our center the Lexel stereotactic frame, and we start in the morning with the assembly of the frame. As the fixation of the frame is under local anesthesia, we prepare lidocaine epinephrine in a solution. The next step is the fixation of the frame to the skull of the patient. We measure the distances. And then the skin is locally infiltrated at the fixation points, after which the screws are fixated into the external tabula of the skull by screwing in a diagonal direction. Then a CT scan with the Lexel frame and the coordinate box is performed, after which a fusion of this CT scan and a double contrast MRI is performed. Subsequently, we start the planning of the electrode trajectories together with our neurologist and check, especially in the probe's eye view, if there occur vascular conflicts. In our center, we use both orthogonal and oblique trajectories. After the planning is finished, the patient is transferred to the OR, receives general anesthesia, and is positioned, in this case, in a prone position. The Lexel frame is connected to the Mayfield holder at the OR table. Here you see the surgical armamentarium to implant the Dixie depth electrodes. Then the X, Y and Z coordinates are set on the frame. The arc angle is set. As you see here. And finally, the stop and guide. After disinfection, the sterile drapes are put over the patient, the Y coordinate is set and the Z coordinate. Of course, on both sides. All coordinates are double-checked by 2 implanting surgeons, and finally the Lexel frame is installed with the planned ring angle. The twist drill is inserted and a tiny burr hole 1.2 mm is performed. Then the probe for monopolar coagulation is inserted into the burr hole and the dura is coagulated. The next step is the introduction of the fixation screw into the skull, and the stop and guide is afterwards set on 0. Then the distance till top of the screw is measured and the stylet to prepare the electrode trajectory is prepared. Here you see the introduction of the stylet till target. Finally, the Dixie depth electrode, with of course the same length as the stylet, is introduced till target level and fixated on top of the screw. This was the first part, namely the implantation of the oblique electrodes. For the second part we use a so-called L-piece, for which we also set the Y and Z coordinates. By this L-piece all electrodes will be inserted with a 90-degree angle towards the frame. With the same twist drill, a burr hole is performed, after which the dura is coagulated again. Here you see the monopolar coagulation. The screw is fixated and the distance from skin to top of the screw is measured. This measurement you see here. And this length is added to the length of skin target. Finally, the trajectory is also here prepared by a stylet, and the electrode is implanted and fixated. Here you see an overview with all electrodes at the end of surgery, and the head of the patient is bandaged after taking off the Lexel frame. The next day, post-operative imaging is performed to see the real trajectories and, of course, eventual complications. After this, the registration phase of the Stereo-EEG can start.